Time for our Rising Crisis update. We'll begin with the number of cases here in the United States and around the world, as we always do. So here in the United States, we have 1.2 million cases, an increase of 24,500 since yesterday, 73,539 deaths, 2,472 additional deaths since yesterday. Around the world, the number at 3.7 million with an additional 100,000, and the total number at 264,015. Unfortunately, as we just continue to do these things day after day, Krystal, we see that the death number remains relatively stable, 2,300, 2,400. Almost every single day, and we actually continue to see, if you exclude New York and New Jersey, where the original major pandemic outbreak was, cases are on the rise in a lot of rural America and other places, which is something really of deep concern.
It's deeply concerning, especially because these are places have been on lockdown for a while now, and they felt like, okay, we're not really seeing it in our community. So right as some of these communities are being reopened, we are continuing to see this spread and actually a surge in certain parts of America. We're also getting some more details on some of the numbers in New York. So this is according to New York Governor Andrew Cuomo. An analysis of new patients at 100 different New York hospitals, somewhere around 1,000 patients were analyzed, and they found out that actually 66% of new admissions were from people who were at home. So they got it while they were at home. The next highest place of transmission was nursing homes. That was at 18%. 2/3 now got it at home. So that's kind of a troubling metric that it's continuing to spread, even as people are staying at home. Also, by the way, that same data found that over half of those new admissions were from minority communities. So it continues to disproportionately hit minority communities, which was something that was, unfortunately expected and has certainly been borne out.
Mm-hmm. Yeah, it's just a terrible situation there. I mean, but we also know that in terms of the transmission and where the virus has come from, we're learning something a little bit new. We actually have an interview that will be premiering tomorrow with the Hills correspondent Reid Wilson, but we wanted to play a bit of it for you here today, where he talks about how the coronavirus, as we've covered here on the show, might have been in the United States as early as December. Let's take a listen to that.
There is a growing sense that we do not have a real sense of the scope of how many people this virus has infected. Some estimates suggest that we're underestimating the number of cases by 10 to 20 times, which would mean nearly 20 million people across the United States have probably already had this, the vast majority of whom, the good news is, have either had no symptoms or just the symptoms of a common cold. But the fact is that the serological tests, basically you test somebody's blood for antibodies, that's showing up a lot more. The antibodies are showing up a lot more than we've seen in previous years, in previous tests. So the virus has been around for a lot longer than we know. That means that the overall mortality rate is a lot lower than we initially suspected, but it also means that it's probably spread to communities that don't even know that it's in their midst right now.
It's pretty interesting.
Very interesting. I mean, you and I have both said, we were both kind of sick in December. I had a worst flu of my life, and I remember thinking of this never happens to me. And you look back and you think of these timelines and these new studies about the first possible case could be in November, and they could be spreading, across the world much earlier than we'd originally thought. And it just makes you think about how widespread this disease really is, this virus, the antibodies and the serological testing. That's the only way we're ever really going to know.
Well, that's it. And because we don't have that widespread at this point, we don't really have answers about how many people have had it, how many people are immune. Reid also told us, and you guys should check out this interview tomorrow, by the way. It was really fascinating to talk to him. He has a book about the Ebola pandemic, so he's become somewhat of an expert here. The studies do seem to indicate that if you've had it, you are likely immune, at least for some certain period of time, which is very good news. But we just don't know how many people have had it. We're only just now learning how early it may have spread here in the United States. So still so much that we don't know, which has dramatic, of course, policy ramifications for when and how we reopen and how we approach this going forward.
Still a lot to learn on this disease.
Indeed. Please make sure you like, share, and subscribe so you don't miss any of our show or our crisis updates. We're going to be back tomorrow with another one of these. We hope you have a great day.